Mary Ann Connedy here today with Top of Mind. I'm at Astia Health Clinic located in the Shopko store in Wausau. I'm here today with Dr. Summers. I'm going to let him introduce himself as well as Justin and who they are and what their position here is and a little bit about the clinic. Let's start there. Dr. Summers, tell me a little bit about yourself and the clinic, how you started this venture.
My name is Alex Summers. I'm an emergency medicine physician and board certified in emergency medicine, trained in Milwaukee. Spent a lot of time in the emergency department and pre-hospital care, cardiac resuscitation, a couple private practices, one in Fort Atkinson. You may have seen Mark Wozniak, our co-VP, who was doing the demonstration, who's a physician assistant and friend of mine, as well as Justin, who's also our other co-VP attorney and my brother-in-law. We started the business back in 2014 to try to improve the three pillars of care, access, cost, and experience, and try to blend a new version of house calls with a better, we feel is a better resource model to deliver healthcare services to wherever they're needed. We built everything from scratch, from the software itself, which has many different pathways to try to provide a patient-centric, great experience for patients so they have access to service, including primary care and urgent care services, and now in employer solutions.
And as Alex said, my name is Justin Slatke. I am an attorney, so we kind of make strange partners, I guess, in a sort of way, but we are related, so that's how we make it work. And I'm one of the vice presidents along with Mark Wozniak, who you will see on one of the videos that we just did. I was working in St. Louis as a healthcare attorney and Social Security disability attorney when we kind of developed the idea for Astia Health, and once we kind of got it off the ground, I decided to make the switch full-time and moved up to Wausau from St. Louis because I thought we really had a chance to revolutionize healthcare and the way it's delivered, and to really be able to attack those three pillars that Alex mentioned. And I think with our combination of technology, our labor model, and the value on patient quality and patient service that we emphasize, that we are well on our way to doing that. And we're really looking forward to this next year and the years ahead, being able to change the healthcare landscape.
In our community, you've recently partnered with Merrill Iron, for example. Tell me about moving forward with Astia Health, what that expansion looks like. Where do you want to take that further?
It's a good question. We talk about that internally often. We have a pretty experienced board that has a lot of healthcare experience with other systems locally and regionally, as well as experience in the legal and financial industries that helps enhance our business model as we look to the future and how we're going to scale our business. So our company is actually divided into two. Oftentimes we get asked, what does Astia mean? So we chose something that reflected in Greek mythology the focus of what we're trying to do in a clinically integrated model, or what was defined by the Affordable Care Act as the patient-centered medical home, and what that looked like. From our perspective, we want it to be what the patient wants it to look like, and less what systems want it to look like, which is population health. That's our focus, and how can we help make that better? So the name means the Hestia, the Greek goddess of hearth and home, and we changed the phonetic spelling. Looking forward to scaling, we have a technology company and a clinical services company that you see in Marathon and Wausau, in mobile, and also working with Merrill Iron and Steel, as you mentioned. We have other on-site clinic or employer solutions we're looking to partner with, and we have another contract and other things we'll be announcing soon. We feel in this space we're positioned well to help employers optimize their benefits for their employees and their dependents on their benefit plan by offering a solution to an area of the economy that really doesn't have a lot of solutions for healthcare innovation on cost containment and access. what does that mean? So on a basic level, employer-based healthcare benefits traditionally, have been offered to employees, and based on rising costs and unable to keep up with rising costs, other than cost shifting and changing networks. Some innovative companies in the last decade or so have brought on-site solutions from different vendors, so to speak, or even healthcare system entities that have an on-site clinic, which typically, in other words, to get the return on the investment for the company to actually see savings, it typically requires a company that's over 1,000 members or so to make that worth installing a full clinic, hiring a provider, and staff to support it. So we feel in our model, we can aggregate companies that are smaller and offer different types of solutions, because what we built, we feel, is sort of in a lean model of great people from the community, best source resource allocation on availability, and our own cost structure for their labor, as well as the technology, allowing providers to be available that are licensed in the state of Wisconsin, both in central Wisconsin and the Milwaukee metro market. So we can resource allocate really well, and keep the overhead down and provide solutions for those employers that they otherwise wouldn't have, with virtual care, with mobile-based services, and even some on-site clinic services by aggregating future clients. So there's just a lot of ways to scale.
Okay.
One other last thing is that we'd like to, the technology piece alone, not just clinically and pairing it together, but using what we built, since we spent a few years building it, and selling our software and hardware to systems so they can take advantage of resource allocated virtual care and provide better solutions and access for their patients.
I have a question about working with employers. So tell me what that would look like. You're working with a particular employer, and they're off, now there's this benefit for their employees to come to receive care at Astia. Is it most often everyone that's insured on their plan with that employer, or is it just the employee?
So we're trying to provide value-based care in the context of a very complex healthcare system. Often I get comments from even members on our legal team within our business on how complex and bureaucratic the system has become. When it comes to providing benefits, of course, it's a business unit to the employer that needs the benefit, and then the healthcare entity obviously has to deliver high quality service at an affordable price. We'd like to provide a value-based model in our clinical model. In other words, here's our member per month charge, and we give you this amount of services. In other words, it's driven based on the needs of the patient, where we have time to spend with patients, and that drives clinical decision making instead of a treadmill type environment where it's test driven and less personal. So it's really provided to the entire staff that we contract with, and then to supplement that, if there's what's called a spousal carve out, which means the spouse carries a benefit from not the employer they're employed by, but their spouse's healthcare benefit, that they then are able to contract with us through our insurance contracts that we have to still utilize the service on a traditional fee-for-service model. In other words, you get a healthcare service is rendered, you pay through your carrier, which is traditionally how it's been done.
Mm-hmm. So for the general public, what is the cost to come to you here at the clinic?
So we have many different models on how our services can be paid for. I think there is a lot of, unfortunately, cost shifting that's made it confusing. So we have for patients that prefer to pay cash-based pricing, we offer significant discounts that you won't see offered anywhere else in the area, except for maybe the typical FaceTime visits, which we also offer as well, which can be as low as $40. We're considering even maybe even pushing that down a little bit to make those even more affordable. This clinic right now is set up direct to the public to be $99 for our basic visit. That includes, for instance, for a sore throat, strep test, or a mono test, for urinary tract symptoms or other reasons, a urinalysis, urine pregnancy test, and glucose testing. So those are all included in this clinic. We're also recently extended that to our location in Marathon, and then our great staff who've been innovative in marketing and social media and coming up with punch cards for some moms have really liked having those punch cards, 2 visits for 1 free visit, so 2 $99 visits for, and the 3rd visit is free, especially with the respiratory season here, where it's typically, there's a lot of illness, we're all inside, it's cold, and there's a lot of contagious illness spread, and a lot of services are needed. So another opportunity to really cost contain for families that, you know, the deductibles are becoming higher and higher, and so first dollar expense, or what you pay, Carrie, and or I pay, or Justin pays, till that deductible is really, it's a consumer market now. So we have to look at healthcare expenditures like you do your grocery bills, your retail bills, and what do I spend over the course of the year? How can I make that more affordable and accessible? That's what we're trying to do.
What are your age demographics you see here?
So I know there's been some restrictions on what previously was here. You know, we certainly know our limits, but we will see any age in our clinics.
Okay.
So neonates all the way up through geriatric patients.
The home service that you provide, can you tell me a little bit about that and how does that work? If someone wants a home visit, what is the process and what does that look like?
So if it's it's a little bit of a difficult question. If they're included in our employer solutions model, we felt taking an on-site clinic and extending that via mobile vehicle with Merrill, Iron and Steel, where similar services could be done in the home. They get those services within a defined mileage included in our value-based model. If it's a home-based visit for a commercial client or patient who has commercial insurance, then it depends upon if they allow home visits. So we thought it would be simpler when we started. We're learning it's more difficult, and we're trying to do you know, what's best for our patients and their families so they don't get stuck with unexpected cost. And unfortunately, sometimes we're tied to insurance contracts. So if patients opt for cash-based models in our healthcare delivery model, we're sort of tied, and we're trying to stem that frustration, which is tied to those contracts, which typically is 3 times higher. So in regards to mobile visits, if it's cash only, you know, we do have a mileage fee that we've been charging. It was much more popular last winter. Not all of our business is mobile, but we do work with patients to make that service available through most of Marathon County.
Okay. If you were to share a primary message to the general community about Astia, what would that be?
I mean, I would just say we're like you and all other business owners. You know, we're a relatively young startup business that's been doing this clinically for a shade under 2 years. You know, we're homegrown. We are a part of the community. We love being a part of the community. We love meeting different business owners and even patients and working together, seeing them as patients and working with them on a business level, and really improving the local economy and making it a better place to live. And one of the ways to do that is, you know, everyone needs health care, right? So we thought we'd build a system where we could make that more accessible and more affordable, and it enhances and enriches our community. And one of the great things, Carrie Ann, that we like about our model is we use EMTs. I'm an EMS director for half a dozen services in our county, and you know, they're very great people that can help bridge the fragmentation that occurs, and actually even make doctors less stressed, whether it's with us or another system, by helping pick up some of those pieces, and then they'd be able to spend more time with what's important with patients. So there's just many ways we feel like we've been able to enhance our contribution.
And on an employer-based focus, what would be your direct message to reach out to employers to talk about some of that additional service, that model that you can provide for their employees?
Well, I think part of it goes back to what Alex said earlier, is that our model is catered to all types of businesses, whether they're small, medium, or large. As he kind of mentioned, traditional on-site clinics, you need about 1,000 employees or more to really be able to make it work. And what our model is able to do is it's flexible enough that we can kind of move in for a company that only has maybe a few hundred employees, but really does want to offer them an added benefit, really cares about them and cares about the healthcare of them and their families. We can come in and we can offer a solution that can work for them at a price point that's affordable for them, that's not going to break their bank. And so it helps to not only make the community healthier by going out to those employers and doing that, but it does help the economy, because those employers then are able to have not only a healthier workforce, but a more productive workforce. So that's the biggest thing that I would say for those employers out there, is if you think this is something that you would want to offer your employees, but you're not sure it'll work, if you have any questions, feel free to give us a call. We'd love to talk to you about it and see what kind of solution we can come up with. We like getting creative.
Yeah, we're always looking to what the next thing is moving forward in the employer space. We like working with self-funded companies, and there's opportunities for smaller companies to become self-funded, which means that your employer actually, even though it looks like a traditional insurance benefit plan, what's called a third-party administrator administrates the plan, and the funds come from the employer. They're allowed to be more creative with the solutions they can offer their employees, in which case, we can become more ingrained within that model to take our pieces and work with them directly as a contract with an employer, with Astia Health, to come up with a solution where they can have on-site services, mobile services, workman's comp solutions, which is very popular. Because we're typically don't charge facility charges, a lot of our fee structures on a cash basis are about half of what they are traditionally in a system, and you don't have to go in and wait, if you're an employer. So it's allowed some of our employers to be more competitive, especially in the metals industry, on subsequent bids, and keep their modification factor low, getting into more of the benefit side of things. And they appreciate not only having enhanced benefits for their employees and families, but keeping the business unit down, so you're not seeing that 6.5% to 10+% annual increase in healthcare costs. What if we could stop that and reverse the trend to a 10 to 20% decrease in annual expenditure? There is a lot. That's a lot of money that you can use to grow your business.
Is there any one or two businesses that you in the community work with on a routine basis with Astia, or that you support?
Yeah, I would say right now, you mentioned Merrill Iron and Steel. Very soon are launching another on-site clinic with a smaller employer in the metals industry, that's Shooty Metals. So we've established a relationship with them, and we are now in the process of marketing to, as you know, Wausau School District, to offer an amazing benefit for them, in that which I believe, coming from an educator background, they deserve, that healthcare services really should be more affordable. They're the ones training our future. They're investing in our children, so we should make sure they're taken care of from the healthcare side of things. And now we're offering, essentially, through their benefit plan, our visits here and similar visits like this in Marathon, and even house calls will be offered for nominal amounts, and in some cases, in that benefit design, fully covered. Stay tuned for details.
That's impressive. So clearly you have created another access point for a healthcare option and are expanding rapidly. So congratulations to you for that, and just thank you so much for contributing to our local economy. Definitely see great things coming from Astia Health and what your initiative is. So congratulations to you on that. We look forward to hearing more about that. As you have additional information for the community, please share that. On your social media pages, where can we find you?
So we have a group page for Astia Health, and then of course we have a website, astiahealth.com, ASTIA health.com. So and I think as part of the chamber and younger population looking to improve the chamber and the economy, I just wanted to reach out and say thanks for spending some time with us today and supporting our business, and as we work together to brighten the future of the local economy in central Wisconsin.
Thank you guys so much. Yeah, like you mentioned, we have a Facebook group that we're most active on. We do a lot of posts on there. We kind of try to make it fun and try to engage the community on there. But we're really happy to be a part of the community up here in Wausau and Marathon County. We're proud of making a better community, we hope.
Thank you.
Thank you.
And to our audience, you can find Astia Health in Wausau in the Shopko store location and at their clinic in Marathon, Wisconsin. Thank you so much for being with us today.